And joining us now is Dr. J.P. Kress, who works on the front lines of the fight as the ICU director at the University of Chicago Medical Center, conducting COVID-related research. Dr. Kress, thank you for joining us today here on The Fight. We appreciate your time.
Oh, thanks for having me. I'm really pleased to be here.
You were recently featured on NBC for the COVID-related research that you are currently doing at the University of Chicago Medical Center. Please, if you would, tell us about this research that you're doing.
Sure. Well, the virus is acquired by inhalation, and it injures the lungs. When the lungs get injured, you can't get oxygen into your bloodstream. And so what the device we use is basically a big hood that goes over your head, and it replaces the conventional tube that goes into your trachea, your windpipe. What it allows is pressurized oxygen to be delivered to the lungs without the breathing tube, because the tube is very uncomfortable. So it allows patients to be more awake, more interactive, and avoid complications of having that breathing tube in place.
So thus far, what would you say has been the biggest effect of this research on the patients you've been able to treat, and has it been successful?
It is successful. This is a very hard virus to treat. So it doesn't work for everyone, but probably about a third of our patients using this device avoid having the breathing tube altogether. And if you avoid having the breathing tube, your chances of getting better and getting out of the intensive care unit without complications are substantially better. So we're seeing some real potential benefit for these patients who avoid getting the breathing tube and hooked up to the ventilator.
So very important stuff. And JP, people say that it may be a year at the earliest before that there's a vaccine that can treat COVID-19. Would you explain the obstacles and the challenges in finding a solution quickly and why they anticipate it's going to take as long as it might?
Yeah, viruses are hard to figure out because you need to tell your immune system what part of the virus it needs to attack. And the viruses are constantly changing or hiding some of those proteins, those indicators. And so developing a vaccine that can target a part of the virus that will prevent it from getting you sick requires us to figure out what part of the virus to target. And that's a real tricky business because viruses are very elusive.
Well, this virus is step number one, but I also want to ask you, how do you hope that your research might impact patient treatment moving forward, perhaps even following this pandemic?
We learned for many, many years that if you could avoid having the breathing tube, you will do better. And there's no question about that. If you have to have a breathing tube, you can still get better, but the road is much more difficult. If we can use this device to prevent people from getting the tube in the trachea and hooked up to a ventilator, we think this can be useful for respiratory failure from COVID-19, but maybe for respiratory failure for other problems as well. So that's what we're hoping.
All right. Well, Dr. Kress, I want to thank you for joining us here on The Fight, and good luck as you continue with your research and your progress. Thanks for joining us.
Well, thank you for having me. I'm really grateful.
We appreciate your time. We do appreciate it.